Hello and welcome everyone to today's seminar in the 2024 Disability Health Research Seminar Series. We are really delighted to welcome today Lydia X. Brown, who is the Director of Public Policy at the National Disability Institute, or NDI. My name is Jennifer Deal. I'm an Associate Professor at Johns Hopkins University and faculty collaborator of the Johns Hopkins Disability Health Research Center, which is directed by Dr. Bonnie Lynn Sweenor. It is really my pleasure to welcome you today. My visual description is that I am a white, middle-aged woman with shoulder-length blonde hair, the top part of which is pulled back into a bun. I'm wearing glasses, white hoop earrings, a pink shirt with text printed in rainbow colors, a black romper, and a black sweater. I am sitting in an office in Baltimore City. I am a late diagnosed autistic woman and identify as disabled. My pronouns are she, her, and hers. In terms of the logistics for the seminar today, the format will be a fireside chat, so we will start with some conversation with our guest. But we will have time for audience questions at the end of our time together today. Please use the Q&A to ask questions. You can post at any time during the webinar today. Your message will be sent only to the panelists, and the moderator will ask your question on your behalf. We do have CART and ASL today. CART services can be accessed using Zoom or the link in the chat. We want everyone to be aware that the seminar is being recorded. And if you have any technical difficulties, if you have trouble accessing via Zoom, you can contact Mindy Dumuchowski at epits4@jhmi.edu. That's EPITS4@jhmi.edu. We humbly acknowledge that Johns Hopkins University is located on the traditional and contemporary homelands of Indigenous people. We recognize the enduring presence of more than 7,000 Indigenous people in Baltimore City, including the Piscataway, Lumbee, and Eastern Band of Cherokee community members. This seminar is conducted as part of a course on disability health at the Johns Hopkins School of Public Health and supported by the Disability Health Research Center, which is run out of the Johns Hopkins School of Nursing. We invite you to learn more about the Disability Health Research Center through our website, disabilityhealth.jhu.edu. The center also has a podcast that is called Included, the Disability Equity Podcast that is hosted by Dr. Sweenor and Dr. Nicholas Reed. You can find more information on X, formerly Twitter, at JHU Disability and at Included Pod. At this time, I'm really delighted to welcome our guest for our fireside chat today. Lydia X. Brown is the National Disability Institute's Director of Public Policy. They bring nearly 15 years of experience as a committed advocate, community organizer, and policy expert at the nexus of disability rights and disability justice. Lydia has spoken and consulted internationally and throughout the US on a range of topics at the intersections of disability, race, class, gender, and sexuality, and has published in numerous scholarly and community publications. Their work has often focused on interpersonal, state, and corporate violence, deprivation, and exploitation targeting disabled people at the margins. Previously, Lydia served as Policy Counsel at the Center for Democracy and Technology, focusing on disability rights and algorithmic bias, Director of Policy, Advocacy and External Affairs at the Autistic Women and Non-Binary Network, Justice Catalyst Fellow at the Bazelon Center for Mental Health Law, and Chairperson of the Massachusetts Developmental Disabilities Council. Outside of their work at NDI, Lydia teaches at Georgetown University and serves as co-president of the Disability Rights Bar Association, board member of the National Lawyers Guild, and founding board member of the Alliance for Self-Direction and Disability Rights. They also serve as an advisor for the Transgender Law Center's Disability Project, the Non-Binary and Intersex Recognition Project, and Disability Rights Maryland. Lydia is the founder of the Autistic People of Color Fund, which advocates for disability, racial, and economic justice, with a focus on building generative economies and just transition. Lydia is a lover of all cats, chronic autodidact, and polyglot, and deeply proud of their diverse culinary creations, which friends and family have described as better than restaurants. Welcome, Lydia. We're really glad that you can join us today.
Hey, this is Lydia X Brown. I'm very pleased to be joining you. My pronouns are they, them. I am a youngish East Asian person with short black hair and glasses, wearing a blue collared shirt. And behind me on the wall is a fake background that I wish was real, that shows a floor to ceiling, wall to wall set of bookcases in a light filled room with a fireplace and a very comfortable couch. I wish that I lived there, but I don't.
It's a very inviting background.
I pretend that it's real.
Thank you. Well, thank you again so much for joining us today. You are the Director of Policy at the National Disability Institute, or NDI. Can we start by talking about the type of work that NDI does?
NDI is a nonprofit national organization, disabled-led, that is the only organization in the US that is focused solely and explicitly on disability and economic and finance policy with an aim toward full economic security and justice and financial freedom, inclusion, and well-being for people with disabilities. NDI's work is carried out through a wide range of different projects focused on bridging research, policy, and practice through providing technical assistance, collaborating with other organizations working on disability and economic issues from a civil and human rights perspective, working with state, local, and federal government partners, and working with industry, including financial services entities that are working to become more supportive of and responsive to the needs of disabled consumers and community members. Our work spans a wide range of issues, including working on public benefits and entitlements, Social Security and Medicaid, for example, working on workforce development and access to competitive integrated employment, as well as access to entrepreneurship and self-employment and small business ownership. We also work on a range of issues impacting health, housing, and transportation that directly impact economic security, as well as working on the regulation and provision of financial services and financial products. So everything relating to consumer debt, access to lending, access to home ownership, rental, housing access, as well as access to retirement savings, asset building, and wealth building in general. So that's a very, very wide array of work that we do. We are also the people who calculated the amount of the so-called CRIP tax. That is the amount of money that on average a disabled person must earn in order to maintain the same or comparable standard of living as an otherwise similarly situated person without a disability. So specifically, we found through our research that on average, a disabled person must earn at least 28% more than the average non-disabled person in order to have a comparable standard of living with that similarly situated person. We're also the folks who are behind development of and passage of the original ABLE Act, establishing ABLE accounts as a tax-advantaged or preferential vehicle to support people with disabilities in being able to save some money for life expenses or for pleasure or for other means that will improve their quality of life and be responsive to disability-specific needs without having to compromise their eligibility for necessary benefits, especially Medicaid. So we work on a range of issues that impact people with disabilities. especially low and moderate income people with disabilities. And our goal is a world in which people with disabilities are fully included in the economic mainstream and have the same range of economic opportunities as do all people without disabilities. That work also includes a particular focus on intersectionality within our community. We published a report with the Asset Funders Network about a year or so ago, detailing some of the great disparities within the disability community around income, net wealth, and other markers of economic and financial security based on demographic breakdowns alongside race, gender, and other classifications within the disability community to help, again, better inform and educate policymakers and practitioners and researchers on what that range of issues are. My work as public policy director means that I lead our efforts to influence and impact the development and implementation of regulatory and legislative change that impacts people with disabilities' ability to achieve economic security.
Thank you. If I can pick up on a thread that you just mentioned, which was around intersectionality. So your expertise is very vast. You do have a focus on the intersections of disability, race, class, gender, and sexuality. Can you share with us a little bit about why this focus is important to understand, particularly for public health professionals?
Sorry, can you please repeat the question?
Absolutely. So your work talks so much about intersectionality with disability, with race, with class, gender, sexuality. And if you can talk a little bit about why thinking about intersectionality is so important, particularly as many of those in the audience today may be public health professionals, if you have a public health lens to put on the importance of studying intersectionality.
I think it's important for us to be clear about what the word intersectionality means, because I found in my work that many people do not have access to information about why we use this term, and of course, what its relevance is to public policy development, research, and implementation. So the term intersectionality came to public discourse through the work of critical legal studies scholar Kimberly Williams Crenshaw, who first introduced the term in a set of papers addressing experiences of Black women attempting to receive legal redress for employment-related discrimination on the basis of both race and gender. And Crenshaw's argument about our legal system being inadequately equipped to understand discrimination that occurs because of a result of two or more experiences of systematic marginalization and discrimination hinged upon use of the metaphor that gave rise to that term. The metaphor refers to a person being at a crossroads. If that person at a crossroads is hit by two different cars at the same time, it will be impossible to determine medically or legally which driver is actually at fault or primarily at fault and for which injuries the person has experienced. And the person would likely have experienced different injuries as well as different severity of injuries in either a scenario where they had been hit only by a single car, or in a scenario where they were hit by two separate cars, but consecutively, as opposed to simultaneously. It's a little bit of a gruesome metaphor, and I know that I've heard that before when I raised it, but it helps us to understand that intersectionality is a framework for analysis that helps us make sense of the messy, complicated reality that human beings occupy more than one category, whether of self-asserted identity, of experience, or of categorization as perceived and treated by other people around them. In the disability, public health, and public policy context, it is extraordinarily difficult to have a thorough understanding of the issues facing people with disabilities, and I would argue impossible to adequately address those issues without applying an intersectional framework. And so what that means is if you look at the numbers that we and the Asset Funders Network published in that report, is that the actual amount of net wealth for the average family house that is head of household, the householder is a person without a disability, Overall, that number is substantially higher than the average net wealth for a family where the head of household is a person with a disability, but that's across all racial and gender categories. When you break that down by households that are headed by a Black disabled person as compared to a disabled white person or a disabled person of another race, the numbers and the disparities change. The disparities sharpen, the numbers shift greatly. And this is also true when we calculate, as numbers have been published now by more than one organization, including a group that we've also worked with, the National Partnership for Women and Families has published some numbers on this as well, that income disparities based on gender and based on race are also exacerbated by disability status. That levels of educational attainment, levels of employment stability are greatly differentiated and stratified by the combination of more than one societal and systemic factor. So this also affects ability to access quality and affordable healthcare because one's income, one's housing stability, and one's access to transportation, as well as one's employment status, can all implicate how reliably or not reliably a person is able to access healthcare, what the quality of that care is, whether that care is culturally responsive or understanding. And so similarly, if we have an intersectionally applied analysis that helps us recognize where the issues lie, but also helps us to better craft solutions in partnership with people who are from directly impacted communities. And that framework, again, going back to Professor Crenshaw's example, was initially introduced to help break down what was happening to a group of Black women who were unable to seek and receive legal resolution for employment discrimination claims, where the legal system was unable to account for discrimination that was not merely gender-based or race-based, but in fact was because of the specific combination of being both Black and woman at the same time. So Black men did not experience this type of discrimination. White women and non-Black women of color did not experience this discrimination. It was very specific to Black women, what the experiences were that they alleged rose to grounds for employment discrimination. The intersectionality framework by Crenshaw and by many other scholars and advocates has since become expanded to be useful, again, as a tool of analysis to understand any set of experiences or systematic disparities in which more than one form of systematic discrimination or marginalization are colliding, combining, and compounding to inform, influence, and expand one another. And so this occurs in all different types of scenarios, whether we are describing the impact of financial services accessibility or the availability and access to Medicaid-funded services, or the ability to access gender-affirming care, or the ability to access effective and culturally responsive mental health supports that are not coercive, or whether it affects the ability to overall be in an economically secure enough position not to be experiencing the deleterious mental health effects of poverty, and especially of chronic poverty or housing insecurity that have been demonstrated psychologically and otherwise to cause short and long-term traumatic effects that can induce experiences of mental health disability because of the incredibly damaging and stressful effects of living in poverty and being subjected to systems that do not incentivize or make it possible to be able to attain any level of economic security.
Thanks so much. I really appreciate you going back and sharing the origin of the term. And I just think about how so much of the work that we do, especially in biomedical research, is really just focused on one aspect of a person, whether that be identity or something about them. And so just talking about the importance of thinking of someone as a whole is, I think, a really valuable framework. So thank you. This seminar series is really focused on health equity. Can you talk a little bit about why intersectional approaches to public health research are important for advancing health equity?
This is Lydia. Intersectional public health research takes into account the lived experience and expertise of the people and communities that are most directly impacted by health disparities in order to shape research that can meaningfully reflect those experiences and therefore be responsive in crafting solutions that are proactive, that actually make sense socially, culturally, and otherwise, and that address the actual systematic social, cultural, and political conditions that lead to and accelerate experiences of disablement, experiences of chronic debilitation that actually are structurally responsible for many of the deleterious health effects that people experience. So, for example, an intervention that is targeted at addressing anxiety or depression in impoverished families and communities by simply providing greater access to therapy isn't addressing the underlying social problems of policies that disincentivize wealth building and that trap people in poverty. It does not address the actual chronic impact of having insecure access to food and housing and healthcare that literally causes strain on the brain. And instead, it seeks to apply a Band-Aid to a problem that is much deeper than surface level. So similarly, responding to, for example, an issue of people with disabilities who are having trouble experiencing and accessing doctors' offices simply by providing information about accessibility on a website for a doctor's office does not address the larger problems of not having accessible equipment, of many providers being out of network, of those providers who are in network with insurance companies, whether Medicaid or non-Medicaid plans, being incentivized by the insurance companies' reimbursement policies to spend less and less time with their patients. It does not address the issue that many people with disabilities, especially if they are LGBTQ or they are people of color, or they are from other minoritized religious, cultural, or other communities, from being pushed out of the medical profession and allied health professions in the first place. It doesn't address the underlying issue of high rates of unemployment, about twice that for disabled people than for non-disabled people, that drive lack of access to adequate health insurance, and therefore that baseline economic security to be able to access healthcare. And then, of course, it doesn't account for the experiences of trauma that many people with disabilities, and especially people with disabilities who experience multiple forms of marginalization, will experience when seeking to access healthcare and therefore achieve overall better quality of life and better outcomes in all of these areas. So an intersectional approach to public health research helps to understand and to contextualize individual problems and systemic problems with one another, that many individual problems arise because of systematic problems underlying structural issues, and even where they do not arise because of external issues, can be exacerbated because of those structural and systematic barriers and inaccessible, exclusionary, and unjust policies. It is also a way of understanding, for instance, the vast differences in experiences of disability and types of disability that are caused by intersecting forms of marginalization and of interpersonal and individual experience. So, for example, much research and public discourse about concussions and relatedly post-concussive syndrome and traumatic brain injury that can derive from concussions or be related to concussions has focused on the prevalence of concussions among either amateur or professional athletes. And that is a population that is itself incredibly diverse and includes people of all races, of all genders, of all ages, and of all socioeconomic statuses. However, research has also demonstrated that the leading cause of concussion-related injuries is actually likely to be domestic violence or intimate partner violence. And there's substantially less research in this area of people who've experienced concussions, especially repeated concussions or repeated subconcussive injuries that can lead to later susceptibility to further concussive injury, to long-term post-concussive syndrome, or perhaps even eventually to long-term brain degenerative diseases that have been closely linked to repeated subconcussive injuries. Even less research has been devoted to the experiences of concussive injuries that are caused by people who've been exposed to battlefield conditions, whether within or outside the US, in the veteran population or in countries around the world, people who've experienced police violence that has caused concussive injuries, whether that is related to police profiling or police brutality, or whether that is in the course of an otherwise ordinary arrest in which there's no allegation of racial profiling of any kind. But of course, police brutality is also an issue that disproportionately has impacted communities of color, the LGBTQ community, and people with disabilities. So this is just one example where public health research undertaken with an intersectional perspective could help uncover perhaps much more about how concussions impact people, what the long-term health ramifications of concussive injuries have been, how those ramifications impact economic security and stability, short and long term, for people who've experienced concussions, as well as what interventions, not just individually, but at a societal level, could be effective in decreasing the rate of concussive injuries. So decreasing the rate of concussive injuries, for example, we now know, because of robust public health research, cannot be accomplished merely by encouraging the use of helmets, even though we should encourage the use of helmets for people who are bicycling or who are playing contact sports. But perhaps we also could be engaging in public policy measures that address domestic violence as a leading cause of concussions, that address police misuse of force as a cause of concussions, and many of these other areas that continue to be under-researched in just that one topic area.
Thank you. I think that was a really great example to help us understand. Thank you. I might change subject just a little bit. And so you have, again, vast expertise in a lot of different areas, including on algorithmic bias and artificial intelligence, or in AI, particularly against disabled people. And this is an area that really doesn't seem to get much attention, particularly now in the era of big data, where that seems to be kind of an important buzzword for grant funding and that sort of thing. Can you share what these concerns might be regarding AI and disabled people?
This is Lydia. That is a very big topic that could also be taken up over a period of several hours, probably, but we don't have several hours. So to keep it very brief, we should also be clear in setting the table and the parameters for this conversation that AI refers to a wide range of automated technologies to different levels of automation, and that are used for different types of purposes, which can include making a calculation, making an assessment, making an evaluation, or making a prediction, as well as which can be relied upon by a consumer or a user of such a tool to varying degrees of reliance. For example, somebody that simply uses it but does not act upon the information provided, or only takes it as one of multiple factors, or an individual or an entity that uses output from an automated program as the decision or the driving force behind a decision or determination. The other thing that is important in framing this conversation is that AI, like all other sets of tools, is neither inherently positive for the disability community nor inherently negative. There are applications of AI and other automated tools that are geared at improving access and accessibility, including those designed by disabled people, disabled engineers, disabled user experience experts, and so on. And there are applications based in AI and other automated tools that are deeply harmful to people with disabilities, and that have been demonstrated through research and through advocacy to have, for example, been used in states to automatically cut and terminate people with disabilities, Medicaid-funded home and community-based services to place people in danger of potential institutionalization, which is, of course, contravening the very purpose of the HCBS program and those waiver services. There are also numerous now documented examples of automated decision-making systems being used in the employment context to unfairly, and in some cases, likely unlawfully, screen out applicants with disabilities in violation of federal disability rights non-discrimination protections. And so these are some areas in which AI and automated tools can be and have been proven to be harmful and discriminatory. And of course, there are other areas in which AI and automated tools have proven to be very beneficial, or potentially could have beneficial use cases, for people with disabilities. For example, the development of applications that are supportive of blind and low vision people being able to better navigate independently or access information, or tools that are beneficial to people with dyslexia or post-concussive injuries or other cognitive disabilities to help sort and retain information and break down steps and tasks that are otherwise complex. So, just establishing that baseline, I want to be very clear that AI is not in itself inherently a net good or a net bad, but rather AI tools, as they become more and more ubiquitous and more refined for a variety of applications and purposes, will continue to both offer promise in the ways in which they can benefit people with disabilities in all aspects of life, and accelerate and reinforce existing systematic disparities and forms of systemic discrimination. And so in those areas, our responsibility as researchers and advocates are to be able to identify what specific harms are being caused, and then what the underlying issues are in policy, practice, and society that give rise to the conditions that make that harm or discriminatory impact possible. So in other words, if a hiring algorithm has been discriminatory toward people with disabilities, it isn't necessarily because all hiring algorithms are a problem, but perhaps because hiring processes for a very long time, even before the use of AI, have been largely discriminatory and exclusionary of people with disabilities and pushed people with disabilities out of the economic mainstream, out of the mainstream workforce, and created greater disparities for people with disabilities who, for instance, have experienced incarceration or homelessness, or people with certain types of disabilities, particularly intellectual and developmental and psychosocial disabilities. So in all states, for instance, the unemployment rate of people with IDD is actually elevated above the base unemployment rate generalized across all categories of people with disabilities. And so that, to me, is more likely to be a reflection of long-standing disparities and discriminatory and prejudicial attitudes than it is something that is inherent to the use of the algorithm. The algorithm operates within a societal context. It uses data from existing patterns and practices. It uses parameters that are set by current presumptions by employers and by hiring authorities about what traits should be assessed and measured in a candidate, and what types of candidates are considered desirable and hireable. And those assumptions are programmed in and reinforced in programming. So it is the tool itself is not necessarily the problem, but how the tool is designed, how the tool is deployed, how the tool is refined, who has autonomy and voice over the development and use of that tool, whether that tool is being used to further practices of inclusion and justice, or whether that tool is being used to uphold status quo and maintain things as they have been. And that is true in a wide variety of applications, just using that one as a particular example.
Thank you, Lydia. At this time, I have one additional question for our conversation. So I'd like to encourage our audience members, if you do have any questions for Lydia, please do post them to the Q&A, and you may do so at any time. This final question for you, Lydia, what advice do you have for researchers, particularly those focusing on disability and those who aren't focusing on disability, on how to bring an intersectional focus to data and to research? Oh, Lydia, I'm sorry. I think that you're muted.
Oh no, I
Thank
was
you.
indeed muted. Problem. I was saying it's really vital for people working in data to consult and collaborate with disabled experts on disability communities, disability cultures, disability. My brain also just blanked for a minute on the word I was trying to say, but disability communities, disability cultures, and so on. And that includes disabled demographers who have expertise and training to understand demographic data collection and to be able to do so in ways that are responsive to the many different iterations of disabled experience and identity. As we know, even in this call here, not all people use the same terminology and language, and there are a myriad of political, social, cultural, and geographic, as well as linguistic factors that impact what kind of language people use, There are also robust community conversations within groups of people with disabilities or disabled people about terminology, about group and individual identity. And so having that expertise from multiple disabled community experts, demographers, and otherwise is necessary to ensure that any project that is relying upon data and that is focused on demography is going to be as responsive as possible, including being dynamic where necessary.
Thank you. I appreciate that. At this time, again, we encourage questions. Please post to the Q&A. I will go through the questions now in order. So Lydia, I think building off the conversation and what we were just discussing in terms of making sure that the disability community is involved, our first question is from an audience member who asks, what can a disability rights organization do to encourage research organizations to ensure persons with disabilities are included in their studies and surveys?
This is Lydia. At a baseline, making sure that studies and surveys are actually accessible to people with a wide range of disabilities, both who have web access and who do not, actually paying for necessary auditing and testing and designing to ensure that a web-based form is accessible to people using screen readers, that it is accessible to people who have cognitive disabilities that impact reading, that impact visual processing, for example, and making sure that people with disabilities are being reached where we are, which is not always online. And it's also not always only in disability specific groups. So that can mean doing outreach to other communities in which there are higher rates and prevalence of disability, including the LGBTQ community, including among low income communities. There's a whole separate conversation to be had about why disability is more prevalent in every marginalized community because of many other systematic disparities that create and exacerbate conditions of disablement. But at a very baseline, making sure that materials are meaningfully accessible and dynamic for a wide variety of access needs, and proactively conducting outreach, especially with trusted community partners, to ensure that people with disabilities can feel some level of vetting has taken place if that relationship exists. And if those relationships don't exist between the disability rights organization or the research organizations, then it's incumbent upon them to focus on building those relationships and building trust. In order that people who are affected will feel willing and able to participate in those surveys and studies and then be represented and have those surveys be more representative of the actual disabled community and all of its diversity.
Thank you, Lydia. I think we have next a related question, but it's also one on the measurement of disability, particularly in research studies. So, and in the health system. So the question is, what are ways that health systems and EHRs, electronic health records, can build upon the American Community Survey 6 questions to improve data collection about people with disabilities? For example, do you have thoughts on adding additional questions or anything else?
There are multiple approaches that disabled-led organizations have taken on collecting that kind of information. And generally what I found in my experience to be most effective are asking about different categories of disability and providing at least a couple of illustrative examples so that people who might not be 100% sure if their condition counts as a disability might have more of an opportunity to see themselves represented. So for example, when saying mental health disabilities, listing, for instance, anxiety, borderline, schizophrenia, PTSD, as examples that people might know that they could be counted. Chronic illness or chronic health conditions, for example, fibromyalgia, cancer, lupus, etc. And that does, of course, not guarantee that every single person will be caught, but it broadens the scope of who might recognize that they can be self-identified with what they already know about their life, their body, their mind, and their experiences within the disability category. And, just also noting on this demographic question, most people recognize and understand when responding to demographic questions that the way that questions are phrased doesn't necessarily reflect the language that every single person might use. And so, for instance, somebody who wouldn't normally refer to themselves as disabled in everyday conversation is usually still able to tell if the category says, for example, blind or low vision, that applies to them, even if they might use a different terminology in their everyday life, or even if they are not necessarily totally comfortable with terminology that other people do commonly use, but being both as specific and broad as possible can help identify and capture people with disabilities who might use different framing or language to describe and define their experiences, but also allow for a more accurate picture of who is disabled and what kinds of disabilities they have. And I know that you asked that question anonymously, but if you do want to reach out to me directly about it, I would be happy to share some of the language that I and many of my colleagues have developed for different use cases.
That's fantastic. Thank you. Thank you so much. Our next question is returning to our conversation around AI. And they say, the participant says, considering the concept of AI colonialism, what are some ethical issues that you foresee with how AI might exacerbate negative impacts of globalized capitalism in a post-colonial society? How can we begin to address or mitigate some of these issues?
I was pausing for the interpreter so that folks know, and not wanting the interpreter to have fallen extremely behind. I've asked in the class that I teach at a university for my students to learn about the globalized impact of AI as a force that can also exacerbate racial, gender, class, and disability-related marginalization, which is part of what you were describing as AI colonialism. And more specifically, I believe that it's important for people who are critiquing the use of AI or who are praising the use of AI to have a clear understanding that AI is not developed in a vacuum, especially the use of what have now been in the news for a little over a year now of large language models that require a vast amount of resources to develop, to train, and to refine, that the labor that goes into creating and refining those types of programs often depends upon extremely low compensated and exploited labor conditions for workers who are largely women of color, often Black or brown women living in the global South, and many of whom either have disabilities or are experiencing disablement as a result of working conditions that they are subjected to. There have been numerous articles published exposing the realities of extremely long working hours at incredibly low wages that these workers are paid for in order to input the training data for various large language models, as well as the use of similarly exploited labor in, for example, refining algorithms to detect hate speech and biased content, which have demonstrably and not surprisingly caused really serious adverse mental health impacts, vicarious trauma, for the people who are having to read the most hateful, disgusting, dehumanizing type of rhetoric about all kinds of humans and groups and communities, but especially marginalized communities, in order to better train AI. So this is also widening a gap between those workers who have some access to different types of labor protections in the form of labor law or collective bargaining agreements that can help to enforce their rights, and workers that are currently subjected to extremely low pay, really long working hours, otherwise exploitative and often disabling conditions. And in order to create AI programs that can be used for, again, for a wide variety of purposes, either for the better, but relying upon exploited systems and models of labor in order to do that, or programs and tools that are being used for harmful outcomes, such as increasing criminalization, such as widening the gap between those who are experiencing impoverishment and those that experience access to wealth and economic resources, and exacerbating, again, further disparities in access to housing and access to credit, in the ability to be hired even and to be able to enter the workforce. And so, it is a really broad question as well, to which there's not a concise answer. And Mariam, I'd be very happy to discuss this further in detail with you outside of this time, because I know that there are other questions as well, but it is a big question. Those are some of the ethical issues that are already happening that I think more people need to become aware of and think about, especially in an increasingly globalized world that is incredibly capitalist in nature, that what we do here in the US is not so removed from what happens outside of the United States anywhere around the globe. And the tools that we use and rely on the labor that is necessary to create and refine those tools has implications for the people living within US borders and for labor and economic and technology regulation here. How we might begin to address or mitigate some of those issues, I think part of this entails being more cognizant of the difficulty in regulating tools, technologies, and companies that do operate across borders. And since much of us focus our work specifically within the United States and US-based regulators and US-based companies, US-based industry, it can make it trickier to understand and to have a clear analysis of where our picture is in a globalized and increasingly connected globalized society and political economy. But I would be happy to talk in a lot more detail about this.
Thank you so much, Lydia. We also have a comment from an audience member who starts by saying, thank you for speaking with us. And their question is, as a lawyer, how do you work on the growth from disability rights to disability justice? And I'm sure that you would include this in your answer, but if you don't mind, just so that everyone is also on the same page, if you could start out by talking a little bit about the difference between disability rights and disability justice.
I was just about to do that, to say, for those who do not know, there is a distinction between the disability rights framework and movement and the disability justice framework and movement. The disability rights framework is focused on changing law, policy, existing systems, institutions, and practices to improve social and political conditions for people with disabilities. For example, by strengthening existing laws, as was just announced this week, Department of Health and Human Services has updated the regulations implementing Section 504 of the Rehabilitation Act for the first time in about 50 years, right? That is a huge and major step. Also, in the last week or so, the Department of Justice finalized a regulation regarding web access and computing accessibility for people with disabilities to implement Section 508 of the Rehabilitation Act and apply the Americans with Disabilities Act to web and computing-based technologies. But these are major advances. They are very important and will have major ramifications for the implementation of federally funded programs, services, and activities, as well as privately conducted activities that serve the public or are available to consumers in the public. So this is the disability rights model. If we change and strengthen our existing laws, if we seek to repeal harmful laws, for example, by encouraging passage of legislation that would at the very least increase asset limits for public benefits and ultimately eliminate asset limits that trap people with disabilities in lifelong poverty, if we eliminate sub-minimum wage for people with disabilities so that people with disabilities can be paid at the bare minimum, the minimum wage, alongside non-disabled people, if we do all of these types of work to improve existing laws, pass new laws where needed, and repeal harmful laws, then we will, through various combinations of formal and informal policy, improve conditions for disabled people. The disability justice framework and movement is focused on transformation of culture and society. It was created about 20 years ago by a coalition of majority Black, Brown, Asian, queer, and trans disabled people as a radical alternative and expansion on the disability rights framework that understands the work of law and policy as necessary, but insufficient on their own. Another way to understand the critique that the disability justice movement has of disability rights is to just look at the time that has passed since passage of the ADA, which has now been law for almost 35 years. And yet we know as advocates and many of us as people who are disabled ourselves, that institutions of all kinds routinely refuse to comply with the ADA or outright blatantly violate the ADA. and resulting in people with disabilities facing employment discrimination, housing discrimination, education discrimination, as well as discrimination in the civil and criminal legal systems. So even though the law has been passed, and the law is a fantastic law, that law's passage hasn't necessarily translated into removing all of the barriers that disabled people face, namely the problem of ableism, which cannot be removed simply by legislating it away. So the question as how, as a lawyer, do I work on that growth? I answer in two ways. One is that I encourage other people and organizations to learn about and become educated about the disability justice movement. And there are many resources to do that available online and offline in a variety of formats. Shout out to the organization Sins Invalid in particular, which is led by many of the disabled people that helped to create the disability justice framework. And secondly, in response to that question, as someone who's been in advocacy for more than 15 years now, my own work is firmly grounded in disability justice commitments, even as I engage in disability rights work. I believe that as we work to change our laws and policies, we should be doing so by listening to the voices and the expertise of those who are the most marginalized within our communities. And we should be seeking at all times to use the law to the fullest possible extent, whether that is as harm reduction or as actually creating programs and services that truly benefit people and help to bring about more just conditions. And simultaneously to understand that that work is not a substitute or a replacement for also the community of disabled people and allies working to create a better world, and a world that, for instance, does not have racism and ableism and neocolonialism and all other forms of violence, oppression, or marginalization.
Thank you, Lydia. I think as we wrap up the hour, we have time for hopefully at least one more question. The next question is from an anonymous audience member. They ask about the processes that organizations should take. So once the organizations have collected data to support policy change for people with disabilities, what processes can those organizations do to ensure that policymakers and providers have the data that they need in order to make systematic change?
This is Lydia. That needs to be an iterative process. Data collection is not something that you do once, set it and forget it. Effective data collection is ongoing, and it reflects changing conditions as well as changing community priorities, so that the people who are working to develop and implement policy can have access to the best available data, and data that has been collected in ways that, going back to one of the earlier questions, were developed in conjunction with those who are marginalized and therefore who understand what is at stake and what they have to lose if data is collected in ways that are extractive, exploitative, or put people at greater risk of forms of discrimination or disruption in their lives or in their communities because of that data and where it's held. So organizations really need to be working in conjunction with affected community members when deciding what kind of data should be collected, how it should be collected, how it should be classified or categorized, how it should be held, how long it should be held, who should have access to it, and what it is used for. And those are not conversations that can occur in like 5 minutes, but they are part of, again, forming and deepening ongoing relationships of trust with those in affected communities and collaborating with those who are impacted as experts and as co-creators, co-designers, and co-investigators in research projects.
Thank you, Lydia. I think we have one more question, and it seems like a really good question for us to end on today. So, is there an American law or area of law that's on your wish list to reform?
You asked this question as if I have only one, and there are many. But one that I will point out just right off the cuff that many people do not realize is an issue affecting people with disabilities other than what we've already described during today's conversation. The Equal Credit Opportunity Act which is a major tool for enforcement of consumer protections and civil rights in the equal credit arena, does not enumerate people with disabilities as a protected class under that law. And so that leaves a great gap for people with disabilities who are unable to seek any form of legal redress for different types of discriminatory lending. And that has real implications for everything from being able to access housing to being able to access employment in some cases, let alone being able to directly access financial products. So just putting that on people's radar as a little bit of nerdy law that many people in disability policy may not know about.
Thank you. Thank you so much. Lydia, thank you again for joining us today, for sharing your time and your expertise with us. We're really grateful. We also want to thank our ASL interpreters and our CART service providers. Thank you. We also thank you, the audience, for joining us. We hope that you can join us again next week on Thursday, May 9th. The seminar will be from 3:30 to 4:30 p.m. Eastern US time. And we will welcome Dr. Rupa Valdez, who is professor at the University of Virginia, and she'll be joining us for a chat on the topic of measuring and addressing ableism in healthcare and public policy. Thank you again, Lydia, and thank you to everyone for joining us. Goodbye. Thank you.